Hi everyone, this is Dr. Krishnan.K, and today's session on Let's Learn MRI Findings, we will be discussing on the neural foramina stenosis or the neural foramina narrowing. So let's discuss what is neural foramina first. So the opening between the adjacent vertebrae through which the spinal nerve roots are exiting the spinal canal and giving off supply to different parts of the body is termed as the neural foramina. So in simple terms, you can see the basic representation of the vertebral column here, where you can see the individual vertebrae which are arranged one over the other, and you can see a small potential space between each vertebral bodies. So this rectangular piece is called as the body of the vertebrae, and in between the two consecutive bodies, we have a small space which will be filled with the intervertebral disc. And behind that, if you have a closer look here, you can find that there is a rounded opening, which is an opening or exit route from the spinal canal, which is formed between the two adjacent vertebrae, and that is termed as the intervertebral foramen. So on the picture on the left side, you can clearly see the yellow colored lines which represents the spinal nerve roots, and you can see how they are coming out through this intervertebral foramen. So this is how you have to understand the neural foramina first. So let's have a look on what is neural foramina stenosis or narrowing. So here we have a representation of the actual MRI report of a normal section that has been taken through the lumbar vertebrae. So here we can have a look at the disc, and just behind that we have the posterior arch or the neural arch. In between that we have the vertebral canal through which the spinal cord will be passing, and it will be covered by something called as thecal sac that we have discussed in the previous session. And from the thecal sac, here you can see the red marked area, that is the exit route of the spinal nerve roots, and that is nothing but the neural foramina. So here on the right side, you can have a clear look, the spinal nerve root exiting the spinal canal through the neural foramina. So let's discuss what is posterolateral disc bulge and how it affects the exiting part of the nerve root. So here, if you have a closer look, on the left side, the MRI finding shows a normal spinal nerve root exiting through the neural foramina, while on the right side, you can clearly see that there is a posterolateral disc bulge, a prolapsed disc bulge that is actually narrowing down the spinal canal or the spinal canal as well as the word neural foramina. So the exiting nerve root is also getting compressed here, and that in turn causes compression over the nerve root, as you can see in this diagrammatic representation, where you can see the pulp or the nucleus pulposus of the vertebral disc in the vertebral disc is protruding backwards after an annular tear, and that is actually compressing the spinal nerve root, and it is narrowing the neural foramina. So that causes intense pains. That sometimes the symptoms are very common, like the people will complain of having pain radiating to their hand or sometimes to the leg as per the compression happening. So in this representation, it is much more clearer. Like here you can see the intervertebral disc, and there is a prolapse, and that just produces some protrusion, and that compresses the nerve root that is exiting through the neural foramina. So this is how the neural foramina narrowing is happening, and that causes the conditions like there will be severe pain over the neck region or the lower back region that can be seen radiating to the limbs. Particularly, it can radiate to the hands, or sometimes it can radiate to the legs when the lumbar, like spinal nerve roots, are affected. And let's have a look at a clinical finding here. So here in this MRI, this is the sagittal section on the left side, and this is the transverse section. So in both of them, you can see here, you can clearly see a protruding mass from the intervertebral disc, which is protruding on backwards. So if you take an oblique section here or a transverse section through the disc here, you can clearly see there is a posterolateral protruding part that is actually narrowing the neural foramina and causing the nerve root compression. So here you can see the nerve roots are coming out through the neural foramina, And obviously, if the neural foramina is getting narrowed, it will compress the nerve roots that are coming out through it and causes the symptoms. So here in this one, the MRI image that demonstrates a large posterolateral annular tear and the protrusion of disc at L5S1 causing a neural foramina stenosis is there. So I'll repeat, here you can see there is an annular tear. Here you can see the outer annular tear of the windovertebral disc has happened, and that causes the protrusion of the nucleus pulposus, and thus by it will narrow the neural foramina and causing the associated symptoms. So this is how you have to interpret an MRI for the neural foramina narrowing. Thank you. And if you have any kind of queries regarding the radiological anatomy, do post them as the comments below. And thank you once again.